Euthanasia is used to help the suffering of people with an irreversible disease. It is pretty hard to qualify for. There's very strict conditions. The patient must be suffering unbearable pain, and their illness must be incurable, and the demand has to be made in full consciousness by the patient. For the procedure, euthanasia takes place in a hospital where they give you a choice of cyclobarbital capsule or pentobarbital liquid. These methods have been used together or separate. The drug efficiently makes the brain slow down to a point where it stops telling the body to keep the respiratory system working, and within 2 to 3 minutes, the breathing of the patient will cease. There's a big problem revolving around euthanasia. The reason why people have such a problem with euthanasia is because euthanasia goes against the human spirit of fighting and trying to survive. Yet some people choose that route for themselves or loved ones because they think that dying with dignity with this little pain and suffering as possible should be a basic human right. Currently, euthanasia is only legal in Holland, Belgium, and Luxembourg, while assisted suicide is allowed in Albania, Colombia, Germany, Japan, and Switzerland, and also in 5 of the United States, including Montana, New Mexico, Oregon, Vermont, and Washington. However, other countries and states are looking to legalize such a practice in hospitals. An example of a euthanasia case is 29-year-old Brittna Manyard. She found out when she was going to die in April of 2014. She was diagnosed with a malignant brain tumor that would kill her in 6 months. It was incurable. She would have prolonged her life through full radiation treatment, but she would die painfully while all those around her watched her deteriorate. But that's not how she wanted to die. Though death was inevitable, and Brittany's was happening sooner than anyone else's, with symptoms of serious headaches and seizures, and major memory loss, she could barely remember her daughter, and ended up moving to Holland to commit euthanasia. Getting into the pros and cons, on the pro side, I think the right to die should be a matter of personal choice. We are all able to choose all kinds of things in life, from who we marry to what kind of work we want to do. I think when one comes to the end of one's life, whether you have a terminal illness or whether you're elderly, you should have a choice about what happens to you. But I also believe the law should be changed to let anyone with some severe medical condition which is causing unbearable symptoms to have an assisted suicide. I wouldn't want to be unnecessarily kept alive against my own will, suffering unbearable pain. On the con side, campaigning to end certain people's lives doesn't end suffering, but rather it passes on the suffering to other similar people, who now have to fear they are the next people in line to be seen as having worthless lives. And people who have died from a drug overdose have no freedom of choice at all. Moreover, societies that authorize suicide as a choice for some people soon end up placing pleasure on themselves to do the right thing and just kill themselves. Seeing suicide as a solution for some illnesses can only undermine the willingness of doctors and society to learn how to show real compassion and address patients, pain, and other problems. In states that have legalized assisted suicide, in fact, most patients who request the lethal drugs due not to pain, but due to concerns like loss of dignity and becoming a burden on others. Attitudes that these laws encourage. The solution is to care for people in ways that assure them that they have dignity and it's a privilege to live, not a burden, and to care for them as they long live.
After looking at both the pros and cons, my personal opinion is, even though being able to take your own life shouldn't be legal, I can feel empathy for those going through crazy illnesses and unbearable pain. That's why I support the idea of euthanasia, because if I was sitting in a hospital bed, slowly dying and suffering unbearable pain, I would do the same thing that they're doing and use euthanasia to end my pain. To conclude, I agree in the way that euthanasia should be allowed. Those in favor of euthanasia argue that a civilized society should allow people to die in dignity and without pain, and should allow others to help them to do so if they cannot manage to do that on their own. They say our bodies are our own, and we should be allowed to do what we want with them. So it's wrong to make anyone live longer than they want. In fact, making people go on living when they don't want to violates their personal freedom and human rights. It's immoral. They say to force people to continue living and suffering in pain. Suicide is not a crime, and I don't think euthanasia should be a crime either.